Good afternoon. Thank you all for coming. Before I begin, I'd like to do two things. First, I want to offer my heartfelt thanks to our amazing communications team who make this very easy on those of us in leadership here. So first of all, a round of applause for that team. Thank you. I also want to acknowledge that we are gathering today here in a broader context. And as we reflect and celebrate the accomplishments of the School of Medicine, of which we all should be extremely proud, we must also recognize that there are those in our healthcare community that carry the weight of loss, stress, and the uncertainty of these difficult times. I think these moments, though, can remind us of why we chose this field, and our shared commitment to care for others, to serve with compassion, and to lead with purpose, I think will carry us forward. I hope that in the coming days and weeks, we can allow ourselves some moments of reflection, and when possible, even pride and renewal. Thank you all for being part of this extraordinary community. With that, it's my distinct pleasure to welcome today the faculty, staff, learners, and campus leaders, including UC Health President and CEO, Liz Concordia, Children's Hospital President and CEO, Jenna Hausman, who, by the way, suffered through knee surgery and, more significantly, canceled a hair appointment to be here today. Their Chief Strategy Officer, Rafe Schwartz, the University of Colorado Hospital Chief Operating Officer, Robbie Dumond, and Chancellor Don Elliman. Whether you're here today in the room or tuning in on Zoom, your presence demonstrates our shared commitment to this institution and to our shared missions of clinical care, research, education, and community. My goal for this presentation today is to make it informative, reflective, and forward-looking, but grounded in where we are today, but clear-eyed about where we're headed. Well, I'm the one here today that is proud and gets the honor to showcase all of our achievements. I'd like for this address to be interactive. So let's have some audience participation. Unlike a concert where you have to put your cell phones away, it's okay to use them here. You can use your phone to answer our first poll. If you're online, click the link on Zoom. We have folks here representing our different missions. So I'm curious, which one of our missions inspires you the most? Well, it's great to see the depth of the missions that collectively we share and promote. I appreciate your engagement, and if you'd like to continue to engage and follow along with the presentation, you can scan this QR code on the screen to follow the presentation. Today, we're going to cover several topics. I'm going to start by talking about new leadership and our faculty recognitions, followed by highlights across our clinical care, research, education, and community missions. I'll talk through some of our current focus areas, particularly for the year ahead. And finally, we'll get to celebrate one of our school's biggest achievements this year, earning full accreditation from the LCME. Just a note, never ever take a dean's job when the LCME accreditation is due. Before diving into the individual awards, I want to give you a picture of the school from a wider lens. As a nationally recognized academic medical center, we are part of the cornerstone of care for this state and beyond. And our faculty and partners this year supported an incredible 4.7 million patient visits. We also received more than 10,000 medical school applications for only 184 spots. 2025 also brought for us significant growth to our faculty ranks. And the School of Medicine is now home to over 6,000 faculty members, an incredible community of clinicians, scientists, educators, and leaders. Our child health associate and physician assistant programs are now ranked number 3 nationally, highlighting the depth of the excellence across our educational missions. Amazingly, we received almost $225 million in philanthropic support last year alone. And this is an essential and growing component of our ability to invest in people, programs, and innovation. Finally, our Children's Hospital of Colorado ranked in the top 5 in the entire nation this year. Now, I do have to say thanks to the child health faculty and the physician assistant program for realizing Dawn's target of top 5 and 5 instead of simply top 10 and 10. But seriously, thanks to all of you, and this deserves a round of applause. 2025 was a year where academic medical centers across the country faced pressures at the federal and state level that threatened our research funding and our patient care models. However, I firmly believe that we are not just going to weather this storm, but we are prepared to lead through it. One of my priorities was to position new leaders to strengthen our institution, but also to serve our people better. So I want to introduce some of them to you. Over the past year, we welcomed these leaders into new or expanded administrative roles. Dr. Vineet Chopra now serves as the Executive Dean for Clinical Affairs, Quality, and Research. Dr. Shanta Zimmer was promoted to Executive Vice Dean for Education to recognize the importance of our educational mission and also to help her lead the transformative work that she and her team are continuing to do in medical education. Dr. Naresh Mandava was appointed as Senior Associate Dean for Strategic Advancement to guide our philanthropic partnerships. Dr. Leslie Berg, the new Senior Associate Dean for Biomedical Research, will enhance our ability to conduct outstanding basic and translational research. And as the new Senior Associate Dean for Clinical Research, Dr. Agit Dinde will work with Tom Flagg and Mark Banaka and others to position us in the top 3 in the nation for clinical trials. I hope you're seeing a theme here. Our school is strong because it's sustained by our talented faculty. And sustaining those talented faculty requires a team of talented leaders. Dr. Ann Fogarty and Dr. Lottie Derby do that work. Their work in faculty affairs is underscored by a core and important principle. Excellence is inseparable from the development and well-being of our faculty. This year, we also welcomed several new leaders across several clinical departments, including obstetrics and gynecology, emergency medicine, and neurosurgery. These leaders and all of our leaders here form a critical role in shaping our culture and advancing our interdepartmental collaborations, which are key to our success. Following the departure of Dr. Richard Schulich, who will definitely be missed, Dr. Robert McIntyre agreed to serve as interim chair of our Department of Surgery, and Dr. James DeGregory accepted the position as interim director of our Cancer Center. I want to thank them for stepping up and maintaining the excellence of these 2 high-priority areas. Also, Dr. David Schwartz agreed to serve as the Associate Dean for Translational Sciences to facilitate and amplify the collaborations of our top scientists and clinicians to realize the dream of CU Anschutz as a research powerhouse. Also, just this fall, Dr. Patrick Hugh joined us as the Director of Medical Scientist Training Program. He's already revamping our admissions process, increasing the mentorship activities, and enhancing our career development programs for physician scientists in training. Welcome to all of you in your new roles. It gets better, though. The accomplishments of our faculty not only reflect individual excellence, but also the collaborative environment that enables us to thrive. Please join me in congratulating and thanking these colleagues for representing the very best of the School of Medicine. Please hold your applause to the end if you can. Dr. Neil Epperson, Chair of Psychiatry, was elected to the National Academy of Medicine, the top recognition in this country for people in the medical field. Dr. Richard Krugman, former dean, the big shoes that I try to fill every day, received the Robert Wood Johnson Foundation Health Policy Fellows Program Lifetime Achievement Award. Dr. Ron Sokol, who serves as the Chief Scientific Officer for Child Health, was awarded a Lifetime Achievement Award from the American Liver Foundation. And Dr. Mark Moss, Professor of Medicine, was honored as a distinguished professor. You did good. But that's not all. Dr. Christina Wilson received a National Academy of Medicine State Health Policy Fellowship. Christy Kuhn and Dr. Catherine Muselman earned the Presidential Early Career Award for Scientists and Engineers. And these are just a selection of the accolades for this year, but they all serve as a huge testament to the talent we have all around us. A very well-deserved congratulations to you all. Our leadership and faculty really serve across our tripartite mission. But in many ways, clinical care is the heart of this campus, and often the most visible expression of our impact in our community. By the numbers, we continue to lead. And here are just a few insights. UC Health is #1 in Colorado and ranked nationally across 4 different specialties. I mentioned children's top 5 in the nation status, something that we should be extraordinarily proud of. Denver Health also has earned top billing in Colorado for its social responsibility. Our close partnership with the Rocky Mountain Regional VA Center ensures that our veterans in our community receive world-class compassionate care. And our partners at National Jewish continue to lead not only locally, nationally, but around the world for respiratory care. I believe that these outcomes are the direct result of the dedicated teams that practice across our care footprint. The clinical stories that I'll highlight tonight, from multidisciplinary cancer care to global advocacy for rare disease, demonstrate what is possible when expertise and innovation come together. The work we do here means a lot for many patients, but some of us know patients whose lives have been changed or even saved. And I'd like to share one of those stories with you tonight.
Over one weekend, I just had horrendous pain, to the point that I just stayed curled up in a chair that whole weekend with back, shoulder, and stomach pains. They did an ultrasound and they saw a mass, and it was in my pancreas.
I met Carolyn over 10 years ago, and what stood out about her case was the fact that we initially thought it was stage 4, and we thought this was going to be a typical advanced metastatic pancreatic cancer case like we often see. And the average prognosis there is about 11 to 12 months for a tumor that doesn't look like it's resectable, because hers involved multiple arteries and veins. We're only going to do surgery if it's going to be curative, or at least curative intent. Carolyn did get a second opinion at one of the cancer centers in New York, and I often tell people I need to sleep well at night too, so I like second opinions. I put her on what's called a maintenance therapy. It's just a pill that you can take twice a day, and most patients their cancer would get worse after a couple months, maybe if you're lucky a year or something, on that maintenance therapy. And what happened was every scan we kept getting, things never spread. It never got worse. So I presented her at one of our conferences, and I said to the group, this might sound crazy, because we initially thought she had stage 4 and she's been on 4 years of maintenance, and I don't know if this is the right thing to do, but it seems like we should consider surgery in this case.
The collaboration between several members, specialty and service line in the cancer center is, I think, the only way complex cancer, like pancreas cancer, should be approached today. Radiologists reviewing the slide, pathologists confirming the diagnosis, medical oncologist, surgeon, radiation oncologist, GI doctor, trying to identify the best strategy and also the timing for different part of the multimodal treatment.
You're having to rebuild and reconstruct arteries and veins, and very few people on this earth can do that other than Dr. Del Chiaro. He calls himself an Italian plumber, and he's a very skilled plumber because these are vessels that supply the entire gut. So if he's in the middle of surgery and can't connect them, the gut of that patient will no longer be functioning and that patient won't live. After a long surgery, he texted me and said, "We got it."
The bedside care is so important to healing, and I never had to wait or wonder where are they. They were always there. Sometimes a little bit too much at 2 o'clock in the morning, but they were always there, so I appreciate that.
Whenever you see the results, clearly that's accomplishment of the team and of an institution that is investing in a program. It's so beautiful seeing them all together, enjoying as a family, and also making plans for the future.
After 10 years, seeing someone every 3 months, she knew about my family and my kids, I knew about her family and her kids, or she'd come back from a reunion, or her kid graduated high school, and then they graduated college, and then a kid got married. I mean, you get to know each other really well, and her husband was at every single appointment. So it's incredibly gratifying to say, I think you're cured and you should just go live your life.
To me, a university hospital is where I feel that the most research, the most leading edge technology, that's what they're about, studying, learning, and sharing that information. People continued looking and trying to find solutions. I am so grateful for that.
What an incredible story, and I'm so honored that Carolyn de Graffenried and her husband are with us here today. Carolyn, please stand. Thank you so much for coming. Thank you. Many families have received life-saving care thanks to the strength of our faculty. But one garnered some unique attention from a very big name this year. A documentary entitled Matter of Time. It was produced by none other than Pearl Jam lead singer Eddie Vedder, featured Dr. Jamie Feinstein. The film brings epidermolysis bullosa, a rare skin disease, to the world stage, literally. The EB program at Children's Hospital is a nationally recognized center of excellence. In the film, Jamie talks about breakthroughs in treatment with the ultimate goal of finding a cure. Now, what CU event would be a CU event without a nod to our very own Coach Prime? Coach was brave enough to share his story this year as he was treated on our campus for bladder cancer. Deion Sanders was at a routine checkup when a mass on his bladder was found. He was immediately referred to CU Anschutz and treated by Dr. Janet Kureja. Janet is one of a few surgeons who not only perform the robotic removal of the bladder, called a radical cystectomy, but also a robotic reconstruction of the bladder. Coach Prime, I'm glad to say, is now fully recovered and cancer-free, thanks to both of these CU heroes. We're also accelerating technology to increase access. In partnership with Denver Health, Dr. Honora Quinn Bennett and Dr. Sandra Sarabi are delivering pediatric care directly to Denver schools using telehealth, expanding access to timely medical services for students who might otherwise face significant barriers to care. This program, I think, is one of many that reflects our commitment to meeting patients where they are. leveraging innovation to improve access, and strengthening partnerships that advance health equity. Fueling much of our clinical work, research really remains a defining strength of our school and a critical driver of future clinical and research excellence. In this fiscal year, we received $655 million in total rewards, including $276 million from the NIH alone, and we launched 1,280 new clinical trials. Now, despite weathering the current storm, there are reasons to be optimistic. The new federal budget should bring an additional $400 million increase in funding to the NIH. And in today's fiscal environment, that matters. But it also reflects a continued bipartisan recognition of the value of biomedical research. Now, a big story. This past October, the Nature magazine index ranked CU Anschutz number 5 for research in the world. Number 5 in the world. Did you hear that? What makes this recognition, I think, meaningful is how this index is calculated. What Nature does is it measures high-quality research output. It tracks publications from leading academic journals and attributes credit based on institutional authorship and contribution. I think this is something we should be extremely proud of. In terms of funding, we're also doubling down in areas that we perform well. A $64 million NIH grant was awarded to Dr. Gene Kuttner this year to establish a palliative care research consortium to support faculty dedicated to improving the quality of care for people living with serious illnesses long term. In addition, the Anschutz Foundation invested $50 million to launch a CU Anschutz Campus Mental Health Collaborative. A $40 million anonymous gift to Colorado's only academic eye center boosts research into the treating and curing of serious eye disease while also investing in the necessary new technology and the recruitment of the necessary top talent. In addition, a $15 million gift by Tom and Sydney Marsico, stewarded by Kim Muller from CU Innovations, will add rocket fuel to a data science and AI initiative that will focus on understanding why pancreatic cancer exists and how to cure it. Much of this is thanks to the tireless work of our campus advancement team. Vice Chancellor Scott Arthur, Assistant Vice Chancellor Allison Krebs, along with Dr. Naresh Mandava, and newly appointed Assistant Dean Sarah Cabot. Thanks to all of you. Garnering attention from multiple news outlets, including USA Today, Newsweek, Colorado Public Radio, and the Denver Post, a study led by our interim director of the Cancer Center, Dr. James DeGregory, found that COVID-19 respiratory infections, remember COVID? We seem to forget those things, but it was pretty bad. What they found, I thought, was incredible, being part of the immunology field myself, that this infection can actually reawaken dormant cancer cells. What James showed is that in the lungs of patients that had this infection, cancer metastases could evolve, metastasize, and actually cause death. This story was one of our highest performing referenced articles in the School of Medicine newsroom ever, thanks to that incredible research team. Through our Transforming Healthcare community lecture series, the Marcus Institute for Brain Health and the Combat Center highlighted important breakthroughs in trauma, traumatic brain injury, and PTSD care. This work reflects a defining strength of our campus, that is, the ability to accelerate innovation, not just from the bench to the bedside, but in fact from the battlefield to the bedside. And building on this momentum, CU Anschutz will be launching the CU Combat Army Star Program. This is a one-of-a-kind, first in the United States. This initiative reflects the amazing and robust trust in our expertise at the highest level of the United States Army and underscores the role of our medical school as a leader in trauma care. Extraordinary work, team. I feel this is like any other State of the Union address, except that half of the people are clapping and the other half have their arms folded and vice versa. It's great to see that we can all celebrate these things together. In a challenging federal funding environment, we also have taken deliberate steps to support our scientists, postdoctoral fellows, and graduate students. This year, over $12 million was committed by our departments and their chairs, which was then tapped by researchers facing award terminations and delays, and our graduate students and postdoctoral students who really were questioning their future support as scientists. Now, we're not a school without our learners. Our mission of education is how we shape the future of medicine and discovery science. Our learners are at the heart of everything we do. These numbers tell a great story. They tell a story of our commitment to excellence and our commitment to educating a compassionate healthcare workforce. Did you know that nearly half of our recent GME graduates chose to practice in Colorado, which strengthens our state's healthcare workforce? Our graduates also give our school a grade of A+. And since 2016, we have significantly expanded student scholarships to the tune now of $1.6 million annually, which improves access to education and affordability. Following an ambitious TREC curriculum redesign, I am pleased to say that we have achieved full LCME accreditation through the 2032-2033 academic year. This is a big deal. And in 2031, it'll be a setup for the next dean. Dr. Shanta Zimmer and Dr. Bonnie Kaplan and the accreditation manager, Kristen Hayden, led the team in this achievement. I'd now like to share with you a short video that explains what this new TREC curriculum is all about and why we are so absolutely proud of it.
I would say we probably have one of the most innovative medical school curriculums in the entire country right now.
We could have said, let's just keep the status quo. It's too hard to make change. And the leadership didn't want that. The leadership said, no, make it better.
That involved redoing soup to nuts, the beginning of the curriculum through all 4 phases. We are spiraling our learning objectives so that people learn not just science and then clinical medicine, but science and clinical medicine and health system science, which is our health and society component of the curriculum.
So when I'm talking to prospective students about the TREC curriculum, one thing I really highlight is getting them into the clinical space sooner.
In the first phase, the planes, we've designed our curriculum to prepare students to enter the clerkships on day 1 as meaningful team members. We have an integrated curriculum that includes clinical skills, the medical sciences, as well as health system science. Our students work in teams to test and develop their knowledge and apply that directly to patient care. Our students are really developing confidence, developing their professional identity as medical students. They're really preparing to take care of patients in an authentic way in our modern care delivery systems.
In the second year of our curriculum, the Foothills phase, our students are enrolled in longitudinal integrated clerkships. Our students really benefit from this model because of their relationships with their preceptors, from whom they get longitudinal coaching, as well as their patients. They really get to understand what that illness experience is all about. Putting our students front and center in front of their patients and allowing them to be the doctor throughout their clerkship was really important. It's not just about what the healthcare system can do to train our students, it's about what our students can contribute to the community and to the patients.
The Alpine Summit phase of our curriculum, otherwise known as the post-clerkship phase, is the part of the curriculum where students really transition from finishing required curriculum that we want all of our students to be able to have and do by the time they graduate into a much more individualized curriculum. Students will usually pick a clinical major, and they will do the courses that prepare them to be great physicians in that major. And we start equipping them to be able to go out and make a difference in the community. And then that last piece is really, we think about layering on an additional level of professional identity for students as they learn that they can take great care of patients in front of them, and they can have larger impact on the community.
I really enjoyed how, with the new curriculum at that point, they were doing everything within their first year in terms of classwork. And so starting clinical time second year was kind of unheard of. Coming to Colorado, that was one of the primary reasons, was because of this new education model that they were putting forward. It just offers a lot more opportunity to see what it's like to be in an inpatient setting or be in an outpatient setting or just working as a part of a team. All of that has really come together quite nicely, and overall has equipped me both with what I call the textbook knowledge of medical school, but then also kind of the real world people skills of how do I navigate these other situations that really can't be replicated in the classroom.
I had quite a bit of clinical education before coming here, and this is the best clinical education experience I have ever had. For a lot of reasons, CU is great at preparing clinical leaders that are not just able to perform medicine to like a good technical standard, but are also able to integrate into the community. I want to be good, and I feel like I have gotten the tools here that prepare me to be better than I have been.
It's a very powerful way of learning, not just medicine, but learning about healing, which I think is sort of the entire curriculum. They're getting the experience now in their very first day of medical school, which is phenomenal. I think it truly changes the way they think about medicine. It changes the way they think about their roles as healthcare providers. And perhaps the most important thing, I think it changes their humanity, which is what we're all about here at the medical school.
Thank you. Our Trek curriculum is certainly one of the most innovative in the country, and I distinctly remember reviewing it and learning about it in preparation for the LCMEA accreditation, and it made me want to go back to medical school, almost. Trek gives us a competitive edge by getting our medical students into the clinical space sooner. This past year, before our second-year students entered real operating rooms, they got a taste of what it would be like by an on-campus simulation. Dr. Anna Neumeyer helped to design and run this 2-day simulation, which took place at the Center for Advancing Professional Excellence. This past year, Dr. Mary Cruz Flores, a postdoctoral fellow in the Department of Pediatrics, was named the 2025 Pew Latin American Fellow in Biomedical Sciences. This is one of 10 postdoctoral fellows from 5 Latin American countries. She will receive 2 years of funding from the Pew Charitable Trust to conduct research. A first-time collaboration between CU and CSU was marked this year by our inaugural class of medical students graduating from our branch campus. This past May, 7 graduates walked across the graduation stage after spending 4 years at the Fort Collins campus. Our education highlights from the past year reflect a commitment to this type of innovation, rigor, and opportunity that really extends beyond our campus. We're seeing an impact far beyond our schools and clinical sites as well. Through rural health endowments, community health programs, expanded behavioral health services, we are building care capacity across Colorado. Our community mission reflects our responsibility as a public institution to extend expertise beyond our campus and into the communities across Colorado. Echo Colorado is a learning platform that provides healthcare professionals a technology-enabled knowledge-sharing community. Through Echo Colorado, we were able to train more than 1,100 clinicians and community professionals, expanding access to specialty knowledge and strengthening the quality of the care that we deliver statewide. In addition, more than 23,000 unique Medicaid patients also received behavioral health care through the School of Medicine programs supporting our most vulnerable populations. The Joanna Sakata Family Rural Health Endowment was also designed to address the rural program's greatest needs. Together, these numbers, I believe, reflect a community mission focused on access, equity, and partnership, ensuring that the impact of our school reaches well beyond our own walls, as it should. Perhaps one of the most visible community engagement efforts this year was the STEM Poster Day at the Colorado State Capitol, organized by Project Bridge Colorado on our campus. Project Bridge's mission is to foster public interest in primary science research in medicine and other fields, and to help young scientists actually communicate their work effectively to a general audience. This event brought undergraduate and graduate students, postdoctoral fellows, and medical students, many from our school, directly to the Capitol to share their research with lawmakers and the public in clear and accessible language. The response from community members and business leaders was exactly what Project Bridge aimed to achieve: curiosity, connection, and a deeper appreciation for how scientific discovery affects everyday lives. As we look ahead, our focus areas are clear. My vision, as I've said many times for our school, is to be top 10 and 10. What I can also tell you is that that vision, that goal, is not that far out of reach. Just wait till you see what comes next. We are navigating uncertainty in research funding now, but we are maintaining our unwavering commitment to quality care. We are thoughtfully integrating augmented intelligence to support clinical, research, and educational excellence. And in all of this, we will continue to prioritize faculty and staff well-being. Speaking of well-being, earlier this year, I was pleased to learn that we had very positive results from the Climate and Well-Being Survey. We have seen a decline in reported burnout and an improvement in fulfillment, particularly, and I think importantly, in our APPs and residents. This is an important signal, I think, particularly this year when there are so many ongoing pressures facing us in academic medicine. I will say that these trends really reflect intentional investments in well-being, in leadership, and in structural supports. At the same time, we really do view these results not as an endpoint, but as a measure of accountability. Well-being remains and must remain our strategic priority, because sustaining excellence really depends on health, engagement, and fulfillment of our faculty. These improvements in faculty and trainee well-being matter not only for the individuals who work here, but for the patients who we deliver care to every day. When our clinicians are supported, engaged, and able to practice at the top of their profession, it shows up in patient outcomes like the ones shown here. UC Health and Children's Hospital Colorado continue to demonstrate real and measurable improvements in quality, safety, and value. Together, these outcomes reflect a shared commitment to advancing excellence in patient care and highlight the critical role the School of Medicine and all of you play in improving quality across our partner hospitals. Our top 10 vision is not simply about rankings. It's about building a roadmap that positions this School of Medicine as a national leader across all of our missions. Over the past year, we have made meaningful progress in quality, in safety, in discovery, and in training. These successes reflect deliberate choices, deliberately investing in our people, deliberately strengthening our partnerships, and deliberately aligning our work across this campus. Looking ahead, I believe that Top 10 provides a framework for what comes next. It guides how we will build on clinical excellence, accelerate research with real-world impact, strengthen our educational programs, and become more involved in our community. Just as importantly, it shapes how we tell our story, ensuring that the School of Medicine is recognized as a place where innovation thrives, clinicians care, patients receive exceptional care, and learners are inspired. Our goal is to position CU Anschutz among the absolute very best, not only by traditional measures, but by outcomes and impact. Top 10 in 10 is about sustained excellence, and it will continue to guide our decisions as we move forward. Before we move on, though, I'd like to pause a moment to hear from you again. When we talk about top 10 in 10, I know that it means different things to different people, and I'm curious what it means to you. So what do you feel makes or will make our school top 10? Well, what a beautiful picture of what we're all about. When we were doing our test run of this, some of the communication faculty actually did put their own names up here. Shanta, I hope you weren't the one that put your name up here. Together with our patients, we have all accomplished a great deal this year, despite a challenging environment. CU Anschutz is a place of breakthrough science, exceptional care, transformative education, and incredible engagement in our community. We are powered by a community of innovators, clinicians, and learners shaping the future of healthcare. And I believe that this video captures that spirit.
In the quiet moments, when you're alone, your dreams can feel out of reach, even impossible. But what if your dream was our dream? What if we never dreamed alone? At CU Anschutz, we're turning dreams into life-changing discoveries together. Because this is where dreams live.
The state of our school is strong. It's strong because of you. So thank you for your leadership, your dedication, your commitment to excellence across all of our missions. I am honored to serve as your dean, and more importantly, deeply grateful to work alongside of you. Following this last upcoming message of thanks and congratulations, I invite all of you to join me and our school leaders for a celebration in the lobby just outside. Thank you all for coming.
One of the great things about full accreditation from the LCME is that we get a clean bill of health, allowing us to be innovative and creative in the next phases of our curriculum design, focused on building a generation of physician leaders. Congratulations to everyone who worked on the LCME site visit and in preparation for our accreditation. I'm so proud of all of us.
Congratulations.
Congrats. Congratulations to the University of Colorado Anschutz School of Medicine.
Congratulations to the University of Colorado Anschutz School of Medicine.
Congratulations.
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 I want to extend a heartfelt congratulations and thank you to the School of Medicine.
Congratulations.
Congratulations.
Congratulations to the University of Colorado Anschutz School of Medicine.
Congratulations. Congratulations to you, Anschutz School of Medicine.
Congratulations to all of you, and thank you. Please enjoy the rest of your night.